Thank you, everyone. And thank you, Juliet, for sharing the Voices of the Valley series that NCPC and the American Heart Association produced. And a big welcome to everybody who's attending right now, the 43 attendants. So welcome to this webinar brought to you by our center, the UC Merced Nicotine Cannabis Policy Center and the American Heart Association. A big thank you to everyone who helped produce this, including our umbrella organization, the Health Sciences Research Institute, and the wonderful panelists and contributors, and those of you who registered online and submitted amazing questions in preparing for this great event. So I'd like to, in starting off this welcome to everyone who's here, so much has been happening. First of all, what a year already, 2020, all the things that are happening. So insane. And one of the things that I gotta say, there have been, it's so cliche to say this, up and downs, right? It's like a roller coaster. That is such an understatement for this year. But one of the things that I've got to say that was a really bright spot that, was a big win for us in tobacco control this year with SB 793. There are, of course, challenges ahead of us. And what we're hoping to do is share some information and thoughts that will really help us as advocates and researchers on the ground to prepare us for what's coming up in the future so that we'll have more tobacco wins that will really strengthen our networks and ties, and, to have, fulfill a vision of an end game where there is a world free of tobacco and tobacco-related diseases. And so on that note, I'm gonna pass on, the time for our panelists, as well as our esteemed colleague, Jamie Morgan from the American Heart Association.
Thank you, Dr. Song, and good afternoon, everyone. I'm excited to introduce our first panel. Lindsay Freitas is joining us. She is the Advocacy Director for California and Hawaii for the Campaign for Tobacco-Free Kids. She has a bachelor's degree in politics and economics from UC Santa Cruz and an MPA from the University of Southern California. Also joining us is Jim Knox. He's the Managing Director for the American Cancer Society Cancer Action Network. He has an undergraduate degree from Stanford, is a graduate of the Coro Fellows Program in Public Affairs, and has a master's degree in public policy from the Claremont Graduate School. They both were very much involved in the passage of SB 793, worked on the issue for the past 2 years, and have also done a lot of work on the ground. So at this point, I'd like to turn it over to Lindsay to share the history and status of SB 793.
Well, thank you, Jamie. And I'm excited to be here. I know for everyone, Jamie, Jim, and I have been working on this bill for 2 years, going back to the beginning of 2019 when Senator Hill first introduced the SB 38 bill, and have been working really hard on that since then. And prior to that, have been working at the local levels to pass these policies. So I just want to provide a little bit of information on SB 793. I think everyone is familiar with it, but SB 793 is the bill that just passed. It was authored by Senator Jerry Hill, and it includes all flavored e-cigs, menthol cigarettes, and most flavored OTP. There are a few exemptions in this bill. It exempts hookah, pipe tobacco, and premium cigars. So cigars over the $12 mark. This bill passed with super strong support. It had 64 co-authors, 21 in the Senate and 43 in the Assembly, including some Republican co-authors. So that was really exciting. And It also had bipartisan support in both chambers. So it was supported by all members of the California Black Caucus as well. And as it was passed, it's effective January 1, 2021. Next slide. The bill was signed into law on August 28th, and then the tobacco industry immediately referendized the bill. As soon as they submitted the paperwork on August 31st to referendize it, that kicked off the 90-day window for them to collect signatures. They needed to collect 632,000 valid signatures. So probably actually need to collect around 900,000 signatures in order to meet that number of valid signatures. And those signatures are due on November 30th. They have until the 30th to submit those to the county election offices, and then that kicks off this whole process of counting the or determining whether or not they have a valid number of signatures that they need. If and when that does qualify, it will halt the implementation of SB 793. We will not be able to move forward with implementation at a statewide level. And it will push that back to November 8th, 2022. So 2 years of delay on the implementation of this bill. And so it's a long time before we'll be able to have a chance to overturn that. And with that, I'll turn it back over to Jamie.
Lindsay, that's really helpful. I'd now like to invite Jim to come off mute and tell us what's happening at the local level and why it is so important to continue to pass local flavor ban policies. And Jim, before I let you talk, I know the slides are blurry for folks, but I'm sure we'll be able to make available the complete, these slides after the webinar today. So Jim.
Great, thanks, Jamie, and thanks for inviting me. I'm very pleased to be here. And let me just provide a little background to the slide that's going to come up in a minute. And that is SB 793 is kind of a part of a trend that we're seeing in efforts to overturn state law, whether by blocking it through a referendum process or by replacing all or part of it through the initiative process. And we saw one of each of those on this election cycle, this ballot, and they both succeeded. You may recall Prop 22, that exempted app-based drivers from state law passed last year about employee benefits, and Uber and Lyft put in $200 million on that effort to overturn that portion of that state law. And we also saw Prop 25 this year, which blocked state law passed in 2018 to reform the cash bail process. And that was after the bail bond industry financed an effort to qualify and pass that referendum, which is similar to what the tobacco industry is trying to do. But the model that we're hoping to replicate goes further back to the 2016 ballot. You may recall Prop 67. That was the referendum that the plastics industry put on the ballot to block state legislation passed 2 years prior to that to ban single use of plastic bags. Very similar to the effort to prohibit flavored tobacco that we are engaged in now. The folks who are trying to ban the single use of plastic bags very deliberately tried to make progress at the local level to win public acceptance and generate momentum to pass the state bill. At the time that they were on the ballot, or their bill passed, at the time their bill passed, they had figured that they had covered about 25% of the state with local ordinances to prohibit the use of single-use plastic bags. And their goal was to get to 50%. And that is very much our strategy here. As you can see from this slide, there are 102 cities and counties in California that have now passed local ordinances to prohibit the sale of flavored tobacco, covering about 9.3 million people, which is about a quarter of the population. So our effort in the next 24 months is very much to try to pass additional local ordinances. We'd like to get up to 50% coverage from the state. The idea being that if people are already living under a system where flavored tobacco is restricted, that it'll take the steam out of the effort to try to overturn that, and that people will have experience living under that sort of regulation, that they'll like it, or at the very least feel that they're not experiencing some of the horrible things that the opponents will try to project as something that will take place if this law goes into effect. But the very interesting thing that the plastic bag advocates determined was that after the election, they did an analysis of the vote, and they determined that in areas that already had a local ordinance to prohibit single use of plastic bags, they won handily. And in the areas where there was no local ordinance, they tended to lose. So this very much shows that the best thing that we can do to get this effort enacted in 2 years, and it is going to be a yes vote, not a no vote. Best thing that we can do to prohibit the use of flavored tobacco and get that state law in effect will be to pass local laws between now and then. So I will turn it back to Jamie for Q&A, if there are any.
Thank you both. That was a wonderful overview. And yes, we do have a few questions, and I'm sure some more will come in the chat box. But questions for the two of you. What have you seen as the most important elements of a local flavor ban campaign?
I'll take a stab at that first, and it goes back to the slide. I'd say the very most important thing is to have a strong ordinance that has no exemptions. And of the 102 that have already been passed, more than 2/3 have been strong ordinances with no exemptions. So that's the first thing I would recommend. Secondarily, be sure to use the model ordinance that is in use around the state that's being provided by the Public Health Law Center. And finally, I would suggest that one thing you don't always see in these ordinances, which we recommend, is that if there's not a local tobacco retail license program in effect, that the ordinance establish one. These programs work much better if it's in the context of a retail licensing system.
And Lindsay, what tips can you give around expectations along the way? For instance, how have you seen the tobacco industry respond to the efforts of a local flavor ban campaign?
Yeah, I think we should expect that the tobacco industry is going to be there and watching really closely, especially now moving forward. We have seen that the industry likes to utilize front groups and works behind the scenes to kind of do their dirty work and let retailers and local vaping associations and the likes, be the front of the opposition to the campaign. And I think that carried through, that's carried through at the local level and all we've seen, and that's carried through at the state level as well. The additional bit of information that I will add is that what we have seen is that traditionally the RJ Reynolds and Philip Morris take turns on who is opposing something or leading the charge on the opposition to something. One of them will run a lawsuit, the other one will file the referendum, the other one will rally the retailers. What we're seeing right now is they're working together, which means that this is big time for them. So they're putting all their cards on the table because they know what's at stake.
Yes, they are laying all of their cards on the table. I don't think we've seen anything like this, at least for a very long time. So knowing this, what steps would you suggest when you're thinking about a campaign, how best to get started? So Lindsay, either you or Jim, please.
I can jump in, and I think one of the really crucial early steps anybody needs to undertake when they start embarking on one of these campaigns is looking at their coalition and making sure that they have community members that are bought into this issue, that their coalition is representative of the community that they're trying to adopt this, and that you have the right voices and the right people that are going to show up and be the face of your coalition. I think that's the number one best bit of advice that I would give. And I'll let Jim add anything.
Yeah, and as part of that, I encourage folks to contact their local lead agency, just so in the county that the jurisdiction is located, just to be sure they know of what efforts may already be underway and what funded programs may already be working on flavored tobacco, and to work to reach out to local heart, lung, and cancer and TFK staff. ACS CAN has local staff responsible for every region in the state, so we will have a local staff person working on flavored ordinances in the area.
So Jim, you talked a lot about the work at the local level, why it's so important. And I know it's always helpful to be able to point to specific jurisdictions that may be similar makeup to the one in which you're trying to pass a policy. Can you think of any conservative communities or cities that have passed a local flavor ban?
That's a good question, Jamie. And it's true that most of the jurisdictions, or at least a disproportionate number of jurisdictions, tend to be either in the Bay Area or more recently Los Angeles area. But there are, and we could really use some jurisdictions in the San Joaquin Valley, frankly. There's only one in the San Joaquin Valley that I'm aware of. And if I asked people to guess what jurisdiction it was in the San Joaquin Valley, I doubt that you would, because it's Delano. So if Delano can do it, if Mono County can do it, there's no reason to think that we can't do this almost anywhere in the state of California.
Thanks, I agree, yes. I don't think folks knew that. And we'll be hearing from San Joaquin a little bit later, so it'll be great to hear their perspective.
Amen.
And last question. Well, I think we have time for a couple more questions. Let's go back to the referendum and what the tobacco industry is doing. We know that when they're out signature gathering, they're not being terribly accurate or honest. So how do you think individuals can be prevented from falling victim to the misleading petitions that are out there, and how folks are representing the referendum?
It's a great question. One of the things that I've been trying to tell everybody is to tell your friends and family about what's going on. Make sure the people that know that you are interested in this work know what that referendum does, and not to sign. Because I know that if my family was walking into Safeway and saw someone collecting petition signatures saying they were going to eliminate flavored tobacco, which is what we're hearing these folks are saying, my family would not only sign, but they would sign, and then they'd get inside and they'd text me because they'd be so proud and they'd want me to know like all the good work that they were doing on my behalf. And, the truth is we just have to let our friends and family know that this is what's going on and not to be fooled. But we also have to remember that when the referendum is actually on the ballot, it's going to be a yes vote. We want folks to vote yes in November. So we don't want them to sign now, but we want them to vote yes then. So it's kind of the dance that we're doing, but I think that's the best we can do. I'll also make a plug that if anybody has had interactions with signature gatherers that you feel they were disingenuous in what they were saying and that they were telling you something opposite, please get me those stories. We have a complaint going with the Secretary of State and the Attorney General. Cancer and Heart are both on that complaint with us. And we are continuing to shuffle more and more stories their way about this issue and really making the case that this is a broad issue. Don't get your hopes up. It's not likely to result in signatures being cast out, but it is definitely something we need to make sure we're doing to just always hold the industry accountable.
So a lot of work to be done, and I will say I cannot stress enough the importance of passing local comprehensive flavor bans. Like Jim said, we need to have a groundswell just to show that the state is supportive and we want to see folks covered everywhere, want to blanket the state. We've heard a little bit from Lindsay, and she could go on for hours, I know, about what the tobacco industry, that I'm not saying that in a bad way, Lindsay, what the tobacco industry is doing now in terms of the referendum and trying to, putting in a lawsuit, but then also what we've seen done in the Capitol and what they're doing at the local level. And I will just say, Lindsay, Jim, me from the Heart Association, colleagues at the Lung Association, we are available to help with any questions about how to, deal with the tobacco industry or come up with talking points, because it does differ a little bit depending on the community, but we can do this. We have resources, like Lindsay said, it's going to be a yes vote. When we get to the ballot language and voting and turning folks out, we will have tons of talking points because it is going to get confusing. But I will stop there. I know we could go on, but I think we have a poll question, and then we will move on with the program. So I hope everyone can see the poll question. It is, are you currently engaged in a campaign for a local flavored tobacco ban? All right, great. I'd say the majority, looks like the majority of folks on the call are either currently implementing a campaign or in the planning phase. Wonderful. Okay, so I think we've got a few minutes. There a lot of questions came in, Jim and Lindsay, prior to today, and I think we have time for a couple more questions. And one, which I think is a really good question, is how can we partner with retailers to ensure flavored tobacco products are not being sold, especially among youth? So this is obviously post passage, but a very good question.
Yeah, and it's a tricky one because we do tend to be on the opposite side of things with them as we're trying to adopt these policies. I think that, and I know saying using San Francisco as an example is usually not that good of an example everywhere, but they actually have a really, really great interaction with their retailers, and they've really treated the enforcement of their policy as an educational process where they've had multiple touch points, and they've gone in and worked with retailers to figure out what is flavored and not flavored and some of the more tricky products, and really treated the retailers as part of the solution to removing these things from the shelves. And it was really effective there. And so I think that's I know San Francisco has some lessons learned tools that are really useful. And Jim, I don't know if you have other thoughts.
No, that's exactly what I was going to suggest. I know that there's been some real best practices and successes in San Francisco that I would encourage other jurisdictions to emulate.
Yeah.
Another question that was posed is how can we integrate the menthol ban as well?
Well, the menthol ban should be fundamental. We look at these ordinances not as vape, e-cigarette ordinances, but as flavored tobacco ordinances. And the flavors apply, to traditional cigarettes, to electronic cigarettes, to little cigars, to snuff, any form of tobacco, and should include menthol. And we think that the menthol is such a fundamental component to the flavored tobacco ban that ACS-CAN will not support an ordinance unless it does include menthol cigarettes.
Thank you for that. The Heart Association's in the same spot. One last question, which I think is a good one, is how do we move this policy forward when there are so many pressing concerns, especially when you think about COVID?
Yeah, that is definitely the challenge of the day. And I think that we definitely dealt with that in the Capitol. I think there was a good month and a half, maybe 2 months, where we couldn't even talk to offices about anything other than COVID. They just weren't interested. I think that the truth is this is a problem that is probably exacerbated now that kids are home, and it's still something we need to address. And I think that there are some resources that the Campaign for Tobacco-Free Kids has on our website that might be useful, that talk about the relationship between tobacco use and COVID, and higher, more severe cases of COVID. And I think sometimes you have to take a step back from your advocacy hat, and you have to really be the public health voice and say, you know what, this is the other public health emergency that's going on. I'm going to stay in my lane and talk tobacco, but I'm going to promote resources right now. And then I'm going to come back and talk to you about flavors in a month when the door opens up a little bit more. But I think promoting the resources we can to help the community as they're struggling with this is the best way to show that we're not just trying to come out here and pass tobacco policies and then leave. We really care about the community and we want to help them.
Thank you. And thank you, Jim. I appreciate both of you. Your thoughts and experience are really helpful for everyone to hear and for us to learn from you. So if you can be ready to come back in a little bit to answer more questions, I'd appreciate it. And I am now excited to talk a little bit with our friends in San Joaquin and learn about what's going on at the local level. So you've heard big picture state level. Let's now talk about what's happening on the ground. So with us today is Monica White. She is supervising public health educator and assists with the coordination of the tobacco control activities at San Joaquin County Public Health Department. She received her BA from Loyola University of Chicago, and she received her Master's of Public Health from the University of Michigan School of Public Health. And also on this panel is Daniel Kim. He's the supervising public health educator with San Joaquin County Public Health Services. Since 2001, he's worked in the Central Valley as a project manager in county public health departments, addressing topics such as tobacco prevention, emergency preparedness, nutrition education, and injury prevention. He received his BA in public health from the Johns Hopkins University and his master's in health education services from the University of Virginia. So welcome. It's great to have you here.
Thank you.
And I'd like to turn it over to the two of you to share with us what's happening in San Joaquin.
Okay. Thank you so much, Jamie. We want to speak with you a little bit about our the local ordinance that we're working on to ban e-cigarettes and flavored tobacco sales. So on February 7th, we presented our vaping in San Joaquin County policy options for restricting the sale of flavored tobacco products report to our County Board of Supervisors. So the report addressed the breadth and scope of the vaping epidemic among youth in California and the county. Information related to, could you advance the slide? I'm sorry. Information related to federal, state, and local policy efforts to restrict e-cigarette and tobacco access to youth, and then local efforts to prevent youth access to flavored tobacco and e-cigarettes. And then we also looked at potential policy considerations as well. So the Board of Supervisors recommended that we include the following. So they put forth the following recommendations, and that was for us to research legislative options to restrict access to vaping and flavored tobacco products, to develop a proposed ordinance, and then to conduct a stakeholder engagement process for the proposed ordinance language. And so next slide. So then in order to develop the ordinance, we did the following. So our team reviewed model policy language pertaining to flavored tobacco and vaping products. We developed the ordinance in collaboration with the district attorney. And the ordinance also accomplishes two overarching objectives. And one is to prohibit the sale of electronic smoking devices, and the other is to prohibit the sale and distribution of flavored tobacco products in San Joaquin County. So I also preface by saying that when we did the report, it was really on the tail of the E-Valley outbreak that happened, in California. So that was kind of the impetus for that. So since then, we've been, continuing down this road of developing the ordinance and the language for that. So next, Daniel's going to speak a little bit about our community and stakeholder engagement session and next steps.
Good afternoon, everyone. So on June 10th of this year, the STOP program, our program here at the San Joaquin County, we were able to have a community and stakeholder convening. We had to do this virtually, of course. We were in the midst of COVID, kind of a lockdown at that time. So the main goals for the meeting, we wanted to present the draft ordinance that we were able to put together for this meeting. We wanted to collect the community feedback, as well as present the findings, eventually present the findings from the convening to the Board of Supervisors. Next slide. So some of the things that we had to think about, of course, for this virtual convening was outreach. Obviously, it was difficult to gather the people, but basically we started off with our coalition. We emailed invitations, and we reached out to a number of stakeholders and organizations that that we've worked with in the past. We've also put the invitation on our website as well as our webpage. And we convened using our WebEx platform. It was one that we could use at the time in terms of recording, so that we could gather, basically it was, we were able to gather the comments during the session, as well as take in written comments so that we can document that fully for the board. As you can tell, in terms of limitations, obviously the timing of the convening was somewhat tricky. It was after a few months, and of course, in dealing with COVID. Also, just access to technology. We realized not everyone has access to this particular platform. It was one that we had access at the time. And then just in terms of, obviously, there's a lot of dynamic differences with regard to conducting a virtual meeting, as well as in-person meetings where maybe you're able to do more conversational pieces during that time. But we allowed essentially for about a 2-hour session to gather as many comments as we got from the public and jotted everything down and put it into our report. Next slide. Okay, so our next steps at this stage, part of during this time we have to take into account the SB 793 passage, and so part of that is we are looking at the elements of the bill and what would go into law, and then also we wanted to incorporate the items that weren't included in the actual original ordinance. So with some slight modifications, we wanted to make sure that we capture the spirit for SB 793. And we're looking at presenting the draft ordinance with the comments in January, hopefully. And really the next steps after that, we're hoping for passage in sometime in that month. From there, we will have to reach out to the cities to hopefully adopt a similar ban, and then work with them possibly to adopt a tobacco retail license for this. All right, and next step. And that's what we're doing.
Great, thank you so much, Daniel and Monica. What a great example of how to continue to move this work forward in the context of the COVID-19 pandemic. It's very exciting. So before we go into the next Q&A, we'd like to have everyone answer this question in the poll. Are you interested in participating in a campaign for a local flavored tobacco ban? So you should see the poll question on your screen. Okay, wow, the majority are interested in participating in a local flavored tobacco ban, which is really exciting, especially now that we have the great example from Daniel and Monica of the steps that need to be taken, and the example from Delano, which I'm interested in hearing more about. So this next section is a question and answer opportunity for the entire panel. And I'd like to pose the first question to Daniel and Monica. So our prior panel mentioned that a great blueprint for putting forth a local flavor ban was San Francisco. And we know that our localities in the San Joaquin Valley are different than those in the Bay Area. And so I'm wondering if you could talk a little bit about how they're different and strategies that you suggest that might be unique to our setting in the San Joaquin Valley.
Let's see, so I guess I can answer that. So with the Valley, of course, definitely in terms of political dynamics and just in terms of our economic situation within the Valley, I think those are really important factors to consider when using the model ordinance. When we developed our model ordinance, we looked at all of the elements, and one of the areas that we felt not ready to move ahead yet is really the tobacco retail license. But the key thing that we did get support from our initially from the board. They were very eager to see something with regard to e-cigarettes, and they were very interested in terms of the flavored cigarettes. So with SB 793, I think it's going to help us to get that passed. We didn't want to hinder those elements, especially with SB 793 kind of hanging right now, possibly for up to 2 years. We hope being able to make a passage of our own local ordinance would be a jump start, be able to get others on board within the cities, and then ultimately find a way to be able to fund it.
Great, thank you. Monica, do you have anything to add?
No, well, actually, we really couldn't get to the point we're at right now if it weren't for coalition members and our advocates. So AHA, ALA, Soul Project, the regional CTCP projects as well. So they've really assisted in helping us move things forward. So with my staff, I tell folks, look, we can ask people to to assist us. It's okay to ask for assistance. And what I found is that folks were really encouraged and really wanted to assist in helping move this forward. So definitely use the advocates that are available. And we also got a lot of assistance from the Public Health Law Center, and they really helped us a lot too. So
great. So using those resources made a huge
Yeah.
difference.
Yeah.
And great. I have another follow-up question, but I'll wait. I'll move on to another question. Actually, I believe this is for Jim. If you could talk about if all jurisdictions in California passed, this is from the chat box, passed a local tobacco flavor ban, which the writer says is unlikely, but could you talk about what would be the added benefit of having the state law?
Yeah, well, I think an important consideration here is knowing that state law provides the floor, not the ceiling. And so I'm kind of take this from a different angle. Local jurisdictions can always pass stronger law than the state law. So in the example of 793, we know that there are some exemptions in the state law, which local jurisdictions have stronger ordinances in effect currently, and jurisdictions which don't have laws in effect now can adopt stronger laws than what SB 793 provides by not exempting hookah, premium cigars, and pipe tobacco. And in fact, that's what most local jurisdictions have done. They don't have those exemptions. However, it also works the other way because the state law does include menthol cigarettes. And there are a few jurisdictions, a couple dozen, I think, that have exempted menthol cigarettes. And should 793 pass, that's what would apply, even in those local jurisdictions which have local ordinances currently that do not apply to menthol cigarettes. If 793 passes, the prohibition would apply to menthol cigarettes. So it does work both ways. It kind of, it depends. There are a lot of nuances to these ordinances. So it really depends on what elements are in the local ordinance and what elements are in the state ordinance. Again, we encourage jurisdictions to go for the strongest ordinance possible and follow the model of the 69 or so cities and counties that have already adopted flavored tobacco ordinances with no exceptions.
Great, thank you. A follow-up to that is this question about how to convince local officials to adopt the local flavor ban. I know we've talked a little bit about this, but just taking into consideration the conservative nature of many of the local governments in the San Joaquin Valley, do you have suggestions for how to move this conversation forward? I think Daniel's point about being selective with your ordinance in response to the local context was it's a really creative and exciting way of or strategy. So I'm wondering if others on the panel have thoughts about how to convince their local governments.
Well, Lindsay, chime in and go back to the need to bring those impacted with you and have their voices be heard. I think that is always a powerful tool to help. And I think that goes a long way to help make legislators understand the impact this is having within their own community. And then I think really doing a deep dive into your elected officials and understanding what makes them tick and where their pressure points are and where they're going to be moved. Is having the doctors show up, is that going to be more impactful? Is it, is it more important to highlight the targeting of the Latinx community? Is it, each legislator is going to have their pressure point, and this issue, we work on an issue that impacts them all. And it's just, it's a lot of work, but that's that's going to be the most impactful.
Right. And researching and cultivating champions is really critical. It's really important to have, someone on the council or the board of supervisors who's going to be your champion, and is really committed to it. And, again, the importance of working strategically in jurisdictions where you think you might have someone like that, or you might think that you've got a shot at, getting the 3 of the 5 members of the city council or the board of supervisors to go your way. If you get that first one passed, the rest of them become a lot easier because, typically these ordinances, are successful. And when you've had a city or county do this and had success, it becomes a lot less scary for all the rest.
Great, thank you. So to follow up on a thread that was mentioned in the chat a bit ago, it was, I think, Jim, you mentioned that Delano had been successful in passing an ordinance, but it was mentioned in the chat that they're thinking of dissolving the ordinance. So I'm curious if perhaps Daniel or Monica or both of you have some thoughts on what could be done to support them or keep them from dissolving it, perhaps.
I guess I'd have to understand. Oh, go ahead, Daniel.
Yeah, I guess, yeah, if there's parts, I guess that are of concern, obviously we want to try to address them. Right now, I think we have quite a bit of support, especially with regard to the flavors issue. I think with regard to the menthol, we are hoping to include menthols with our flavor ban, and really, extend the efforts that SB 793 is providing, hopefully at the state level, and just really give cover to our local governments in terms of being able to have something at the state level eventually. But I think again, I think some of those elements, especially at this time, I know the tobacco retail license, local one, is a concern because of potentially the cost or impacts to businesses. But I think when we explain the value and the impact that we're having with regard to youth, especially the flavors ban, because again, those over 15,000 different flavors isn't really geared towards adults. It is really targeting youth, and I think our leaders recognize that, and I think they're willing to support addressing that factor and be able to support that. And again, we looked at SB 793. One of the issues is, of course, is that it is an unfunded mandate that we're asking enforcement to try to enforce that without any additional funds. So I think one of the the arguments that can be said about local tobacco retail licenses, it does support our local enforcement efforts and give more control to our localities.
Great, thank you. Did anyone else have any comments on that, the situation in Delano and their potential backing off? No? Okay. I think we are getting close to wrapping up our questions. Daniel, you just addressed some of another question that was in the chat about successful passing of a TRL in jurisdiction, but Jade Lee commented that they've been successful, but there are 5 retailers who are going to be appealing because they failed to apply for one. And so she's asking for talking points to remind officials to uphold the TRL already passed. So did anyone have any comments on that question?
I don't have comments. I mean, that's a tricky one, and it's similar to something Sacramento County is facing right now. And so maybe reaching out to them and seeing how they've handled it. They had, this was not with their TRL, it was with a a density restriction policy. They've had some efforts to kind of from retailers who feel like they're gonna go out of business and didn't have the permits lined up, trying to backtrack on some things. I'm not as up on that to share talking points, but I think they might be a really good resource to talk to since they've gone through something similar recently.
And I'll just add, and of course, I don't know the specifics either, but one thought would be to talk with the electeds and let them know there was a reason this was passed, folks support it. How can we work with those retailers to address their concerns? So starting more from, let's figure out how to help these retailers, and then kind of back away, like this is already done. There's already, folks have already decided this is an important policy. So rather than just totally repealing it, let's figure out how to make it work, because we all want to, the community wants to.
That's an excellent point, Jamie. Really excellent point. I think we are coming to the end of our time. Unless anyone has any last comments that you wanted to make or any additional questions. We could probably take one more question if there is one. No. Yes, Anna, did you have a question?
I was just pointing out there is one about directing some of our local groups to evidence-based material. And I think this is an important point, specifically because having as much evidence-based information and practices is just going to be critical, bringing science to the Valley. So if the panelists could speak to anything in terms of directing some of our groups to what the science as well as best practices are that we can consider and also adapt to the culture and climate of our region, that would be incredibly helpful for our group.
Thank you, Anna. Excellent question.
I mean, yeah, there are a lot of fact sheets and collateral on the California Tobacco Control's program's website. And in addition, we do have a kind of a joint statement on local ordinances, which we could, I don't know if we can put it in the chat box, but we can certainly make that available to folks.
Something NCPC can offer is that, we can absolutely have more thorough conversations of how this evidence might be adapted for our local, region. So absolutely, something that we are very open and eager to talk to everybody about.
And I'd say, I think all of our organizations have materials, in terms of the science and effect of using flavored tobacco products. But in terms of public policy, I'll just put in the chat box, CTCP is obviously a go-to, as Jim mentioned, but the Public Health Law Center,
Right.
which I believe Neil mentioned, has resources. We have the California Tobacco Center for Policy and Organizing. So maybe I'll just put a few little things in the chat box, but we have resources galore. So please do not hesitate to reach out to anyone.
Right.
Yeah, as Anna mentioned, NCPC can sort of collate these materials and send them out in digest newsletters, or they can be available via our Slack channel. Which we're going to ask you all to sign up for in just a moment. So if Juliet, if you could advance the slide, I think we are about to move on. So I just want to make sure everyone knows that notes from today's meeting, we'll have those available. And we'll also have a recording of the webinar, and there will be subtitles in Spanish available, and that will be available on our website, which is on the slide. And you'll also receive email notifications with the latest news and updates. And we'd like for you to keep in touch with us through the NCPC Slack channel. And I just want to say that one, thank you to this amazing span of expertise that we've had the opportunity to hear from today. Really wonderful from state level to an incredible local example of efforts that are pushing forward in the context of a pandemic. So really great example of how to keep this movement going despite our current situations. And I would just highlight what I see as kind of the three takeaways. One, I think that we have heard over and over again, which is the importance of local engagement. What's happening at the state level shows that things can really get slowed down. So as Jim and Lindsay and Daniel and Monica have argued, we need to push forward at the local level to put pressure on the state. Also, you've had a great examples of resources that are available. Daniel and Monica talked about Change Lab, the Public Health Law Institute, as being really helpful in their ordinance development. So, and not to mention their experience. I mean, they're your colleagues, so you can reach out to them. Lindsay gave the great example of what's happening in Sacramento. We have these models throughout the state that we can rely on, so we don't have to reinvent the wheel. We can just adapt these best practices to our local situation. So resources are out there, and I just want to urge you all to keep talking to each other and to reiterate that NCPC can serve as sort of a convener for these kind of conversations and as a repository for some of the resources that have been discussed. So keep things going in your counties, and we look forward to hearing great things as we move forward in this fight. So thank you all for coming today and being a part of this conversation.